Hello and welcome to your online class. Today we are going to discuss competency-based education and the medical assistant student. Our learning objectives for today are to define, spell, and pronounce the terms listed in the vocabulary, discuss competency-based education and adult learners, summarize the importance of student portfolios in proving academic success and skill competency, examine your learning preferences and interpret how your learning style affects your success as a student. Differentiate between adaptive and non-adaptive coping mechanisms. Apply time management strategies to make the most of your learning opportunities. Integrate effective study skills into your daily activities. Design test-taking strategies that help you to take charge of your success. Incorporate critical thinking and reflection to help you make mental connections as you learn the material. Analyze healthcare results as reported in graphs and tables. Apply problem-solving techniques to manage conflict and overcome barriers to your success. Relate assertiveness, aggressiveness, and passive behavior to professional communication, and discuss the roles of assertiveness in effective communication. The reason that competency-based education is ideal for adult learners is because adult students learn materials at different rates, they have a need to know why, and the instructor can design laboratory activities that meet your needs. We will be creating portfolios throughout the series of your clinical courses. Things that you might want to include in your portfolio are samples of projects completed, samples of key procedural checklists, copies of awards, copies of certifications, letters of recommendation, and many other unique and creative ideas can be used. Who are you as a learner and how do you learn best? First, you must perceive information, and then you process this information. You could be actively processing, jumping in and starting to do things immediately, or you might need to reflect and have to think about the information before it can be internalized. There are 4 stages of learning style inventory, and we will be exploring these more in depth during our face-to-face time. We have stage 1 learners who are concrete and reflective, stage 2 learners, abstract reflective style, stage 3 learners, abstract active style, and stage 4 learners, concrete active style. Again, we will be discussing these more in depth during our class time. Let's take a look at coping mechanisms. Adaptive coping mechanisms, such as time management, can help reduce stress and help you gain control over your stressful situation. It will be imperative that you use time management skills during this next year in your medical assisting courses. Non-adaptive coping mechanisms may actually increase stress. For example, are you a procrastinator? If you are, this is something we will look at and discuss, and maybe we can use time management to help detour you from procrastination. When using time management, determine your purpose, identify your main concern, be organized, stop procrastinating, and remember you. It is very important to schedule time just for you into your time management system in order to revitalize yourself and be prepared for all of the upcoming challenges. Here are some study skills tricks for becoming a successful student. Organize information into recognizable groups so that the brain can find it easily. Create an association with something you already know. Be physically active while learning. Create songs or word associations. Teach the information to someone else. The first step to effective note-taking is to come to class and online sessions prepared. Request copies of PowerPoint presentations, organize notes, review them shortly after class, and create mind maps. You will have access to all PowerPoint presentations during your clinical classes. Please utilize these to help yourself prepare and take notes. In the next 3 slides, you will see examples of mind maps. Creating a mind map is a way of representing a main idea of a topic and supporting it with important details. You can take charge of your success by utilizing the following test-taking strategies. Go into a test adequately prepared. Use time management skills. Read directions carefully. If possible, begin with the shortest, easiest questions. With multiple choice questions, identify keywords. And with true-false questions, look for qualifying terms. To be a critical thinker, you evaluate the results of your learning. Critical thinking involves sorting out conflicting information, weighing your knowledge about that information, ignoring or letting go of personal bias, and deciding on a reasonable belief or action. A graph or diagram or picture represents information and its relationship. Use this information in tables and graphs to help prepare yourself to work as an entry-level medical assistant. In problem solving and conflict management, the first step is to identify the central issue. Then determine whether it is worth the effort to resolve it, brainstorm solutions, implement chosen solutions, and then it's very important to evaluate the outcome. Were you able to solve the problem or resolve the conflict? In problem solving and conflict management, it is also important to follow the chain of command to reach a reasonable resolution to the conflict. Resolve in private, use open, honest communication, and follow up on courses of action. If asked, I'm sure that you could give real-life examples on assertive, aggressive, and passive communication. Passive communication consistently protects the interests of another person over your own. Aggressive communication demands that your interest and needs are met at the expense of another. And assertive communication attempts to defend both your rights and those of the other individuals in conflict. Assertive communication allows you to express your feelings and thoughts honestly, and you are able to stand up for yourself without making an emotional scene. This behavior needs to be learned, and it's something that we'll be discussing further in class. Some indicators of passive behaviors are eyes are kept downcast, the person shifts his or her weight when talking, they have a slumped posture, and whine or uses hesitant tone of voice when talking. Some indicators of aggressive behavior are leaning forward, pointing fingers when talking, raising voice, and sounding arrogant. An aggressive behavior might also include somebody using phrases such as "you'd better," "if you don't watch out," "do it or else," "you should do it this way." Here are some examples how you can take assertive actions. Be honest with yourself and others. Let others know how you feel about a situation. Speak clearly and be specific about the problem, and use I messages along with the assertive body language, such as using good eye contact. What questions might you have about this content? Please take the time to reflect now and write these questions down to bring to class. We will be discussing further the process that we use in order to answer these questions.